A woman asked me that now that she's pregnant, can she continue to play with her husband? I didn't quite get what she meant by playing with her husband. I was about sarcastically asking her, were you fighting with your husband before? But in rapid succession, she made me understand that, doctor, don't you understand? That kind of play that you play with your husband that led to pregnancy. I was like, why not? Why not? If you are physically fit, if you are psychologically or emotionally stable, to play with your husband, that kind of play, you can continue to play with your husband. Pregnancy is a physiological state. Of course, there are a few conditions in pregnancy, either symptoms or complications, for which your doctor would advise you for a coital holiday, for a bed rest, for a pelvic holiday, which means at that point in time, you shouldn't have that kind of play with your husband. Early in pregnancy, first trimester, like some pregnant women will be very specific. They ask, can we play with our husband in this first trimester? If there are signs or symptoms of threatening miscarriage, spotting, or bleeding in early pregnancy or in pregnancy at all, lower abdominal pains that mimic menstrual pain, the doctor would examine you, probably do a scan, put you on a bed rest, probably give you some medications to relax and calm your womb. And at that point in time, he is going to advise or counsel for a pelvic rest, that is for a coital holiday, by which I mean you shouldn't play that kind of play with your husband. The other thing is, are you psychologically stable? Are you psychologically ready part time for that kind of play? There are other conditions in pregnancy, placenta previa, and all of those things. Even your physical strength, will it permit you for that period in time, for that night, to have that kind of play with your husband? You will need to talk with your husband that for today, Oga, this kind of play where you want to play with me, my psychological state, mood swing, this particular symptom, urinary tract infection, malaria in pregnancy, distress at work, or even at home, will not allow me to be able to engage in this type of play with you. And besides, like I said, for symptoms of threatening miscarriage, your doctor has told you you will need a coital holiday. Then, at that point in time, you shouldn't play that kind of play with your husband. Outside this, if you are pregnant, continue to enjoy your play, continue to enjoy your fun with your husband in pregnancy.